Now to this, whether it's in the halls of Congress or in the hallway at your local hospital, the high cost of healthcare seems to be everywhere.
That includes at an annual conference going on in Augusta today, where those who work in the healthcare sector and those in government got together to try to find some answers. News Center Maine's Drew Peters is in Augusta tonight with more. Drew?
Hey, Chris and Amanda. Whether you have public or private insurance, affordable health care is something many Mainers continue to struggle with. That's why organizations and advocacy groups gathered here at the Augusta Civic Center to discuss possible solutions.
We need to have folks back in this fight.
Local healthcare leaders and state officials
that in addition to these cuts from a provider and member perspective, there may be other cuts.
Weighing in on some of the biggest challenges Maine's healthcare system is facing.
We're looking at spikes in healthcare premiums, healthcare costs. Rural hospitals especially are in distress. The whole system is broken.
Those issues being exacerbated by the ongoing federal government shutdown brought on by arguments surrounding the extension of subsidies for citizens who get their insurance through the Affordable Care Act.
So these are people who don't have access to job-based coverage, people who don't qualify for other sources of coverage like Medicaid, which is MaineCare in Maine, or Medicare.
Something healthcare leaders say could raise insurance costs by nearly double for thousands of Mainers.
People are going to stop taking health care because they can't afford it, and that's going to make for an unhealthy economy and people.
Discussing potential solutions to these in a gubernatorial forum, candidates like Hannah Pingree say Maine needs to create a public health option.
But it would use state authority to achieve greater affordability and better coverage for enrollees in private health plans.
Other candidates like Maine's Secretary of State Shenna Bellows also proposing a possible way to keep Maine's hospitals open.
As we need to directly fund rural healthcare infrastructure, basic services all across our state to ensure that every Mainer gets the healthcare coverage they need.
Former State Senator Troy Jackson also mentioning capping certain prescription drug prices to lower healthcare costs.
I would go after a big pharma. I think that they're doing so much right now to hold us back.
Potential solutions that state officials say come at a crucial time when many Mainers are worried about losing coverage because of ongoing negotiation disputes between Northern Light and Anthem.
Costs are going to increase significantly for them, and so they're really going to have to look to see whether they can afford coverage.
Conference leaders say their biggest recommendation for Mainers who are worried about potential insurance changes is to contact their provider and come up with a plan for open enrollment that begins this upcoming November. Back to you, Chris and Amanda.
Drew Peters in Augusta tonight. Thanks so much.